LPNC students. Today we are going to do a bed bath and we are going to do an occupied linen change. So I have all my equipment here for the bed bath. We have a new patient gown, we have a couple of towels and washcloths, we have our bath basin, which we have full of warm water for our client, and then we have a bath blanket to help promote privacy, and then a pair of regular gloves for when we get to the peri area. Now, in the hospitals and the nursing facilities, you may have some pre-soaked bathing products, which is really nice to use, but some places don't have them. So just look for those and you may have an opportunity to use those. Okay. Same rules follow when we come into the room. We're going to introduce ourselves, do our GNAP, and let the patient know why we're here, and then we'll go ahead and start our procedure. All right? So, knock, knock, knock. Good morning, Mr. Jones. My name is Darlene Lepresto. I'm a nursing instructor at Jackson College. I'm here to help you with your morning care and to change the sheets on your bed. Okay? Are you having any pain this morning? No? Okay, good. I'm going to go ahead and wash my hands. Is there anything that I can get you before we get started with your bath? Do you need to go to the bathroom? You just went to the bathroom? Okay. All right. Did you eat breakfast this morning? Yeah? Very good. All right. Well, I'm going to get my equipment situated here and then we'll get started. All right. So I have my warm soapy water. I have my gloves. I'm going to go ahead and raise the patient's bed to a comfort level for my back while maintaining safety for the client. Side rail is up. Mr. Jones, I'm going to put a nice warm blanket on you. I'm going to have you help me with this if you can, okay? Always try to maintain privacy and warmth while you're doing a bath. Let's undo your gown. Okay, and we're going to loosen that up. Can you tell me your name and date of birth? Okay, good. I know, we ask you that 6 times a day, don't we? Okay, are you warm? Yeah? All right. We're going to start with your face, okay? So we're just going to lay a towel across the patient's chest. Now there's a couple different ways you can hold your washcloth. We have the first way that's called a mitten, and you take the washcloth, put your hand inside and fold it over, and then fold it down. That way every time you wipe, you're exposing a clean portion of the washcloth on the patient. You don't want to reuse the same side of the washcloth more than once. The other way is called the four corners. And you fold it up just like a regular washcloth. You start with one side, wash, use the other side, wash, and then fold it over so the dirty goes inside. So now we have clean again, and then continue washing. Bring 2 or 3 of these with you so that you can continue that practice so you have enough equipment available. Okay? So warm soapy water. We're going to wash the face first. And when you start with the eyes, be sure that you start from the inside and wipe away towards the outside. And then we change our 4 corners, wipe away from the inside to the outside. If the patient is able to help you, then allow them to help you as much, because you want to maintain as much independence as possible. And then just continue to wash the face and the ears, once wipe. swipe. And then rinse and repeat as much as you need to. Again, if you need to throw away a washcloth and start fresh, be sure you have extra and have your linen cart, which I have at the end of the bed, ready to go. Okay, we're going to dry. Just pat dry. You don't want to rub because you don't want to cause any skin tears. And we'll do oral care at the end. Okay, we're going to wash his chest. So warm soapy water again. 4 corners. Just gentle strokes down. Rinse, repeat if needed, add lotion to maintain skin integrity. Okay, now let's not forget our ears. That water still warm? Yeah. Rinse. Okay, now we're going to do arms. So with the extremities, you want to start distal and wash proximal. So we're going to put that towel under his arm because we want to keep the linens as dry as we can, even though we're going to change them today. Now if you want to walk around to the other side of the bed, you can, because you don't want to hurt your back. But I'm going to stay on this side so that you can see me with the video. Okay. Again, proximal, or distal, excuse me, to proximal. So you're going to wipe up in nice long strokes on all surface areas. And be sure that you are able to get in the axilla as well. Okay. Rinse and repeat, add lotion, and then we're going to do exactly the same thing on the other side. So we're going to say I washed this one as well. So now we're going to move down to the lower half of the body. And again, you want to keep your patient nice and warm. And I'm going to remove his gown now. And I'm going to put it in the soiled utility basket. Okay, and we can always open this bath blanket up if we need to make it a little more spacious for the patient. We're going to wash his belly because we did his chest. Rinse, 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 soapy water, do your glove, the 4 corners or your mitt, however you'd want to do it. Again, just one swipe. Now if you feel uncomfortable and you want to wear gloves, you certainly can. Rinse and repeat. Add lotion. If you want to wear gloves, you can. You don't have to, but it's between, it's your judgment call and the patient as well. You don't want them to feel like they're dirty. Okay, at this point in time, we would roll them on their side, and we're going to do their back care. So Mr. Jones is going to help me. I'm going to have you reach for the side rail, and we're going to roll on your side. I want to make sure that side rail's up so that he doesn't have any security issues. Put your towel on the bed to keep the linens from getting wet. Warm soapy water. And again, cleanest to dirtiest, so we're going to start at the top, go down the back, change our washcloth side, go down again. One more time, change the washcloth over. And one more time, I'm changing it over. I'm washing all the way down his back. Now I'm going to dry his back with my towel. And I'm going to take some lotion or moisturizer, and I'm going to give him a nice back rub. Just kind of help make him feel comfortable, release any tension, promote comfort, decrease pain, all of that. Okay. Now we're going to wash the buttocks. So warm soapy water. My water's still warm. And then after this, I'm going to change it. With the buttocks, same thing, just stroke down. Change your washcloth over. Stroke down, and then a 4th time stroke down. Now I'm going to get rid of my washcloth. Dry really well. And have the patient come back on their back. Any pain at all, Mr. Jones? No? Okay. All right, so now we need to do his legs and his peri area. I'm going to take this top sheet off, and you can take this off in the beginning if you want or at the end. Just don't hold it close to your uniform. You want to keep your uniform nice and clean. Got a little foot drop going on there. Now during the bath is a really good time to inspect your patient's skin. I went and got fresh water. It's nice and warm again, fresh washcloth. And we're going to do the same thing that we did with his arms. We're starting from where? Distal to proximal or proximal to distal? Distal to proximal. So we're going to just start with the leg and work our way up. Turn our washcloth exactly the same way that we did on the upper extremities. Sometimes using the mitt is better because it kind of protects your fingers. Should have had that under there beforehand. Dry it off. Always offer to apply lotion because it does help keep the skin hydrated. It's really kind of drying in the healthcare environments. So just give them a nice rub down. It also promotes circulation too. We're going to go ahead and do that foot. Be sure you get in between the toes. Plantar surface, and again, watch those heels. Be sure you don't have any breakdown starting in between the toes. Be careful on your diabetic patients. And then thoroughly dry, just pat dry. Again, you don't have to rub. Okay. And then again, we're going to repeat the same thing on the other leg. So I'm going to move forward. The last thing that we do is the perineal area, and then we do the rectum, and then we're all done. So again, I'm just trying to keep them warm, provide privacy. Now on a female, the techniques that you need to remember for a female, and for either one you're going to put gloves on, but for a female you're going to wash front to back, cleanest to dirtiest, so front to back or top to bottom. And then with a male, you're going to start with the meatus and work in a circle around, working from the tip down the shaft, and then you're going to cleanse the shaft after that. So when you're doing your checkoff, verbalize that so that we know that you're thinking about those concepts. Again, cleanest to dirtiest. All right, so female, front to back, especially important to only wipe once. Change your washcloth, do it again. Looking for any excoriated areas, any areas of breakdown that you're going to have to let the physician know about in case we need to get some medication for treatment, some topical medication. All right, and then rinse, again, with water, and we're all done with the perineal area. Lastly, we would roll the patient one last time, wash the rectal area very well, leave your gloves on, then pat it dry. If you need to add any type of cream, again, if there's any areas of breakdown, be sure that you acknowledge that with your instructor or the nurse on the unit. And they have certain creams like Magic Cream that you can put around the sacrum and the coccyx area. Okay? Now we're done with the bath. So I need to put his gown on. And then we're going to change the sheets. So while I'm doing this, we're going to take a break. and we'll get ready, and then we'll go ahead and do a making an occupied bed.